Okay, good evening, everyone. Um, I'm a student of Duane University, and I had a presentation to do on a genetic or disorder. I chose to do isovaleric acidemia. Uh, what is isovaleric acidemia? Isovaleric acidemia is said to be a disorder in which the body is unable to properly break down a particular amino acid, which is known as leucine. This condition is classified as an uh, as an organic acid disorder, a condition that leads to an abnormal buildup of particular amino acids. Abnormal levels of organic acids in the blood, organic acidemia, tend to cause serious health problems. People with isovaleric acidemia have inadequate levels of that the enzyme that helps to break down leucine. As a result, they develop this rare disorder called isovaleric acidemia. It is said that in the United States of America, there is a probability of occurrence of 1 in 250,000 people. So, if we were to look at the major characteristics of isovaleric acidemia, it is said that health problems related to isovaleric acidemia often range from very mild to life threatening. It can occur as acute illness, serious illness, or it can be very severe. In the acute stage, it usually occurs soon after birth. In other cases, isovaleric acidemia occurs in childhood, but may be intermittent. It is said that children with this disorder usually struggle with weight gain and often have issues in development. In the serious stage, it is said that it is important to know that serious health problems can be triggered by prolonged periods of without food, fasting, infections, or eating an increased amount of protein rich foods. In addition, some people with gene mutations that cause isovaleric acidemia tend to be asymptomatic, meaning they don't usually show signs or symptoms of the condition. In severe cases, the signs of isovaleric acidemia often appear within a few days after birth. The first set of symptoms include poor eating, vomiting, seizures, and lack of energy, also known as lethargy. These symptoms would then progress in more serious medical problems, namely seizures, coma, and possibly death. However, one distinct sign of isovaleric acidemia is the odor or of sweaty feet. If we were to move on to the molecular cause of isovaleric acidemia, it is usually caused or associated rather with the IVD gene or chromosome 15q15, which provides instructions for making an enzyme that plays an essential role in breaking down protein from the diet. Specifically, this enzyme helps to process the amino acid leucine, which is part of many proteins. If there is a change or mutation in the gene, which is IVD, that encodes the enzyme isovaleric CoA dehydrogenase, or if there is a mutation that reduces or eliminates the activity of this enzyme, the body is unable to break down leucine properly. As a result, organic acid builds up and you form the you or your you have the disease or genetic disorder rather that is isovaleric acidemia. Um, what is the mode of inheritance? It is usually autosomally recessive, inherited. Isovaleric acidemia is inherited via an autosomal recessive pattern. In other words, this means that the copies of the genes are from both the mother and father in each cell which have mutation. This the parent of an individual with an autosomal recessive condition each carries one copy of that mutated gene, but they're basically asymptomatic. They don't show signs. Um, Here are some scenarios of inheritance. Well, we're gonna let big A represent the dominant allele, and little a represent the recessive allele. In the first scenario, you have both parents that are inflected with the genetic disorder. As you can see here, little a, little a, which is either from the father or the mother. And when you're to do a Punnett cross, you would see that 100% of the offsprings would come out with the disorder, isovaleric acidemia. If you're to look in the second scenario, there is one parent afflicted with the genetic disorder, and the second parent does not have the disorder and is not considered a carrier. So we're gonna have big A, which represent the parent that is not afflicted, and little a, which is the parent that has the disorder. So the outcome would be 0%, that is none of the offsprings would have isovaleric acidemia, but all of the offsprings are going to be carriers. If we're to look in the third scenario, where one parent is a carrier and the second is affected with the disorder, so we would find that the offsprings, it would be a 50-50 chance where um, two of the offsprings are going to be carriers and the other two are going to be affected with the disorder. In the fourth scenario, we have neither parents is afflicted with the genetic disorder, nor are they considered carriers. So in this scenario, none of the offsprings are going to be affected with the disorder, but all of the offsprings are going to be dominant. If we look here, this is a pedigree illustrating the inheritance pattern of isovaleric acidemia. Basically of a family, beginning with John and Anne. John is a carrier of the disorder, and Anne is affected with the disorder. She has it. So of their offsprings, you have Jake, Jason, Annette, and Ava. In this scenario is similar to the third one here, where you have a parent that is a carrier and the other parent is affected with the disorder. So here you have, I'm sorry about that. Here you have a 50% chance of the offsprings having the disorder. So of the offsprings, Jake has the disorder and Annette. And later on in the family, one of the grandchild, Big Arlene, was unfortunately got the disorder from her parents, Ava and Tony, who both were carriers. Now, to look at the options for testing, genetic testing of isovaleric acidemia includes biochemical methods and enzyme assays. The biochemical methods test for metabolites, the metabolite level of the metabolite marker, which is C5 acyl carnitine. At the molecular level, sequence analysis of the entire coding regions can be done, where a bidirectional Sanger sequence analysis is performed. This is where whole gene testing is done, which includes analysis of all coding exons plus flanking intron sequences by Sanger sequencing. This method will identify all missense and nonsense mutations, small deletions, small duplications, and small insertions located in the analyzed fragments. Often there are questions, associated with isovaleric acidemia. One of those questions is testing mandatory or optional? Testing is not mandatory, but is rather optional. However, it is often a routine test that is done during pregnancy. When is the genetic disorder typically done? It is done during newborn screening through a blood test called tandem spectrometry, which is also known as MSMS. Another question is early detection important? Why or why not? Um, I would say that early detection is considered important because isovaleric acidemia can present with severe neonatal ketoacidosis, which can possibly lead to death. But in milder cases, recurrent episodes of ketoacidosis of varying degree can occur later in infancy and childhood. Another question that is often asked is what is the typical cost of testing? That is not exactly known, but I figured since it's a routine screening in newborns, it can be inferred that it is most likely not costly and it is most likely covered by most insurances. And lastly, you may ask what companies offer this test. There are many companies that offer this test, but I listed just two. They are Clinical Biochemical Genetics Diagnostics Laboratory, which is in Miami, and there is Laboratory Genetic Metabolic Diseases, which is found in the Netherlands. Here is my references. I hope you guys learned at least one thing from my presentation. I would say thank you for listening. Thank you for viewing. And have a good night or good morning, good day, wherever you are. Thank you.